Hi, my name is George Adunlin. I'm a faculty member at the McWhorter School of Pharmacy, Samford University, located in Birmingham, Alabama. Today, I would like to discuss the economic methods used in health disparities research and know what's important to know about those. Economic evidence is increasingly being used for informing health policies. Studies using economic methods to investigate health disparities have grown exponentially over the past few decades in conjunction with the passage of the Affordable Care Act. However, the underlying principles of economic analysis to study health disparities are not always fully understood by non-health economists. Inappropriate types of economic analysis as well as inconsistent methodologies may be used for informing health policy decisions and conduct health disparities research. Meanwhile, there is a lack of open access information and methodological guidance for economic analysis and methods targeted to public health professionals. The purpose of this presentation is first to highlight economic methods particularly well suited for health disparities research. Secondly, we want to be able to illustrate the areas where economics methods may be most appropriately employed to investigate health disparities questions. We undertook a systematic review of the literature using the PRISMA guideline. Relevant articles were systematically searched in PubMed, Medline, Embase, PsycInfo, Econlit, and Scopus. Databases were searched for English language publications published within the United States from 2010 to 2022. Articles were included in this study if they were peer-reviewed, if they reported the use of economic analysis or method, or if they explicitly investigated a health disparities question. So we basically were able to obtain 3,479 articles, out of which 201 were selected for review. So the top 10 health issues studied in sample outcome studies were access to utilization of healthcare services, cancer, COVID-19, diabetes, HIV/AIDS, immunization, overweight and obesity, maternal and child health and mental health, substance abuse and tobacco. Most of the studies that were assessed are actually looked at different outcomes, including effects of expanding public health insurance eligibility, disparities in cancer incidence and screening, societal impact of COVID-19, impact of diabetes, related complications on healthcare costs, costs attributable to obesity, poverty and mental health problems, economic conditions, and the use of illicit drugs, as well as racial, ethnic, socioeconomic, and geographic disparities in children's exposure to secondhand smoke. The economic subfield is applicable to health disparities research. Those that are related specifically to health disparities include health economics, pharmacoeconomics, labor economics, public economics, econometrics, and behavioral economics. Some of the most popular methods that were used to conduct health disparities research include econometrics, difference and difference analysis, and economic evaluations, or pharmacoeconomics. So the difference in difference analysis is a useful statistics technique that analyzes data from a non-equivalence control group design and makes a causal inference about an independent variable. The economic models were used mainly in these studies for prediction and forecasting in healthcare planning, risk adjustment to insurers and public providers of healthcare, as well as geographic variations. So most of the methods that were used were panel data models, probability logic models, count data models, instrumental variables, time series models, as well as propensity score. Economic evaluation, which is the comparative analysis of two or more interventions in terms of the costs and consequences, were also used across several studies. Most of the methods that were used include cost minimization analysis, cost effectiveness analysis, cost consequence analysis, cost of illness analysis, cost benefit analysis. Studies were more focused on improving health outcomes than on reducing health disparities. The most studied race and ethnicity included African American, followed by Hispanic, Latino, and Caucasian white. Some of the most important methodological issues discussed in these articles include opportunity cost, identifying the appropriate perspective for the study, and correctly categorizing cost and discounting costs on non-monetary benefits. Some of the economic methods are complex and require high level of expertise in statistics, econometric research design, or better yet, expert consultation. In conclusion,